Hello and welcome to Health Styles. I'm Connie Mead. On our last Health Styles program, we took a look at Huntington's disease, a rare, progressive, fatal disease that presently has no cure. It is truly a genetic disease that passes from parent to child. Well, today we will continue our discussion of Huntington's disease and see what it means for the families who live with Huntington's and the patients who live with this on a daily basis. We will talk about what it's like to receive this kind of diagnosis, how it affects the family, and we'll meet a remarkable young woman who faces her Huntington's disease diagnosis with grace and positive attitude every day. So we'll learn more about this today and also talk about some of the other practical implications of Huntington's, the financial aspects, and maybe discuss as well the pros and cons of getting tested for Huntington's disease. So we have lots to talk about. Joining me today for our discussion are two guests. First is Cheryl Sullivan Staveley, who is a Chelmsford resident and whose family has been devastated by Huntington's disease. Cheryl is also an advocate and an active volunteer for the Huntington's Disease Society of America. And with her is Virginia Goolkasian, who is the manager for the New England and Greater New York, Albany, New York districts of the Huntington's Disease Society of America. So I want to thank you both for being here today.
Thanks you for coming in.
Okay, so before we get to Cheryl and her family story, I just wanted to take a moment to ask Virginia to kind of recap some of the things that we talked about in the last program about Huntington's disease. What kind of disease is it, in case some of our viewers missed that?
Sure. Excuse me. So it is a neurodegenerative disease, and as you said, it is fatal. It's a disease that oftentimes begins in someone's prime of life, in their 30s or 40s. There is a juvenile onset as well. And it slowly impairs their ability to walk, to talk, to swallow. It also causes involuntary movements. And unlike some of the other neurodegenerative diseases, it also has emotional and psychiatric issues. So a lot of people have cognitive changes, but they also sometimes can have some psychiatric issues as well.
So it sounds like the person has to confront this disease on several fronts, the physical and also the emotional or psychological aspects. And then you say cognitive as well.
Exactly. And because of that, it's a very difficult disease to manage in different settings, because someone might be able to manage the physical and not have be able to have the staff or the expertise in some of the emotional changes. And it is different for everybody. Not everybody has all of the psychiatric symptoms or as much of the voluntary movements, but overall people usually have a touch of the emotional and the psychiatric as well.
Okay, and it's not, shall we say, an American disease. It's not brought on by our Western civilization or anything like that, our Western lifestyle.
It's truly genetic. For every parent of someone with Huntington's disease, every child has a 50-50 chance of getting it. So if a parent has it, it's an autosomal dominant gene, and if your parent has it, you have a 50-50 chance of inheriting it.
Okay, so a parent could have it, and if they have multiple children, some of them may have it and some of them won't. Is that correct?
Exactly. Some people think it means if half the family gets it, half won't. It's an individual coin toss for each child, and we have seen everything. We've seen someone have the whole family have it. Sometimes there's some who don't get it, but usually, unfortunately, if there's a few children, the odds are that at least one person does get it.
Okay, and then if you don't get it, let's say your parent has it, you don't get it, you cannot pass it on.
The chain is broken.
The chain is broken.
Point.
Okay.
Mm-hmm.
So there are certain families, it runs in those families, those people are at risk, but you've got a 50-50 chance whether or not you have it.
Exactly.
Right. Okay. And now there's medication and therapies that will help patients with
Yes,
Huntington's?
and
Yes.
we actually have, the Huntington's disease study has centers of excellence throughout the country. Ours is at Mass General, where they can go to get treatment in genetic counseling, but they can see a neurologist and a team of clinicians that understand the disease. So people can get tested, and if they test positive, there's absolutely things that can help to minimize, not so much minimize all of the symptoms, but the impact it has on them. So for depression, they can take an antidepressant. There is a treatment now for people with the movement disorder. It has to be evaluated on a case-by-case situation, and for some people it makes sense to take that medication. And then for the behavioral issues, sometimes if it's not from the psychosis but the cognitive challenges, we can recommend some kinds of things that the families or the caregivers can do to minimize that by how they respond to the person's requests, making lists to help them when they're forgetting things and things of that nature.
Okay, and from onset to the person's death, is it a quick disease or a long disease?
It's roughly, we say, 10 to 30 years. If you have the juvenile onset, it's a much faster progression, as with many diseases. But so if you start looking at the point in time when people have cognitive changes, which often happens long before the physical changes until the person is deceased, it can sometimes run 30 years.
Okay, okay. Well, I want to talk to Cheryl here too, bring you into the conversation. You've seen firsthand what Huntington's disease can do to a family because you've lived through it. And you're not just once, but now you're living through it again, correct?
Correct. My first husband, John, was diagnosed in 1989, and my daughter, Megan, was diagnosed in 2007.
Okay, so less than 20 years later,
Correct.
Your daughter, right,
Correct.
Okay. So now, was your husband's disease, your first husband's disease, was it, you know, as Virginia alluded, a long, you know, progression?
He battled courageously, HD, for about 20 years. He died in September 2008.
I see. So he knew that Megan had been diagnosed, did he? Or, because when did
Megan was diagnosed in March of 2007, but at that point, John was, he had been at Tewksbury Hospital on the HD unit there for 7 years. He was unable to speak. We felt he was able to understand what was going on, but we felt it would be too cruel at that point to tell him, because I couldn't imagine what it would be like for someone to tell me, you know, that Megan had HD and not be able to respond.
Right, right.
So we felt
there was no good that was going to come from that.
Correct.
Right. Okay. So, so you had to see your husband go through this. Now, were you aware that this ran in the family when you two got married? Shall we say?
Overall, I'm going to say no. When I was in nursing school, I met a nurse that took care of John's mother shortly before she died. But John's family always thought, and she did have rheumatic heart disease, but anything that was wrong with her, they attributed it to the rheumatic heart disease.
See. Yes.
This nurse told me, oh no, have you ever heard of Huntington's disease? And this nurse felt positive that this is what it was. However, John's father knew nothing about it, John knew nothing about it, and we asked the family doctor, who denied it. And we got married in 1978, and this is when I was told all this, so I thought, okay, this couldn't be. Fast forward 11 years to December of 1989, and for a few months prior, I had been noticing some oddities, if you will,
changes, right.
Correct, about John, and I also got a call from some of his colleagues at that time that they felt something was going on. And so he was taken to, you know, we brought him to a neurologist. Overall, his neurological exam was normal. However, as soon as I mentioned, well, 11 years ago, this nurse told me about Huntington's disease, and bingo, they decided that this was correct, the diagnosis. And John's mother was an only child. She had died when he was 14, So there wouldn't have been any other further points of reference.
Right, right. And so how was it when you had 2 little children? Because you had 2 little children by this time, so you're trying to deal with your husband who's ill.
Correct.
And you've got 2 little girls.
Correct. Caitlin was 8 and Megan was 2 when John was diagnosed. And although we knew, okay, if this disease would go 10 to 30 years, he would still have some productive years left. But obviously, I mean, it came as a devastating shock. And I have to say, even on the part of John, he was more devastated thinking of what he could have passed on to his girls as opposed to, you know, worrying about himself.
Oh, okay.
And it was very difficult, and at that time, the gene had not been discovered, and, you know, every day I would just look at my daughters and think, oh my gosh, you know, is this going to happen to them too?
Right.
How am I ever going to get through everybody's lives, like, without knowing, or what am I going to see? I mean,
right, it must have been overwhelming.
Correct.
Yes, yes. And did you have support? I mean, was there family support? Or I'm not sure if the Huntington's Disease Society was active at that point. Well, I guess it would have been. Yeah.
Yes. So luckily, you know, I had very good, you know, family and friend support. Although initially we had to be very careful of whom we were able to tell until we felt comfortable because of so many aspects of discrimination with the disease.
Right.
But yes, one of the very first calls that I placed was into Boston to the Huntington's Disease Society of America. And within a month, John and I had attended an education day as well as a support group. So again, that was fantastic within the first month because we were still in a state of shock, but to know, okay, that we weren't alone was very, you know, comforting, and I knew I was going to be able to get information and help me manage.
Right. And how was it telling your girls? I mean, as they get older, maybe they understood different things at different stages, or was it hard? Did you keep them informed, or did you not tell them? Or?
No, John and I were firm advocates that what had happened to us was not going to happen to our daughters. So of course, at the initial time when they were 2 and 8, it wasn't like we were going to sit them down. But right away, we did say, address the issue that Daddy has a muscle problem, you know, because he did have the involuntary, you know, movements, and his coordination was a little off. And as both of the girls, you know, grew, we were able to address more issues. In fact, Caitlin, within the year later, came home one day from school and she said, oh, they had been talking about genes and brown eyes, and that, you know, she had brown eyes, her dad had brown eyes. So she said, so Mom, am I going to get my dad's muscle problem? And so that was a good way to already address the 50-50 chance without, you know, without it being frightening or just sitting, you know, down. And I use that as a teaching tool. And I just said, well, you know, yes, you might get it, but you might not. And so she understood at that point, okay, this is hereditary. But again, we always kept them informed, but the questions or answers were, you know, were age appropriate. But I would have to say, by the time both of them were in middle school, they fully comprehended that they were 50% at risk. You know, they were seeing their dad progress, and they knew what was happening to him could happen to them.
I see, okay. So, and then at this point, so 2007, your daughter then, she must have symptoms and is diagnosed. So were you ready for it at that point? I mean, was it like another just terrible blow when you've got your husband still?
Correct. It was a terrible blow, but it was not a terrible surprise.
Okay.
Megan, really in retrospect, I can say that she started showing very subtle signs cognitively, behaviorally, at about age 14. And it was the summer of 2006, between her freshman and sophomore years of college, that then we also began to notice the motor symptoms. And once you have lived with a person with it, you can look at somebody and recognize it instantly.